Hey everyone, it's Dr. Amitai Worob here at Sea Change Family Chiropractic, and here on Facebook Live, it's Thursday at our new time of 2:30 p.m. on Thursdays. So if you are not subscribed to our YouTube channel yet, please go ahead and do that if you're watching us on YouTube, or even if you're not right now. That way you'll get notifications when we upload these videos to YouTube. And if you haven't liked us on Facebook yet, please go ahead and do that. That way you'll both get us in your feed, as well as get notifications of what we'll be talking about each week, as well as notifications of when we'll be talking, which will be 2:30 on Thursdays. So last week we talked about some of the benefits of chiropractic care, what most folks don't know, 5 things that you need to know about chiropractic. We might as well just keep adding to the list, and one of them is that by medical guidelines, first treatment for low back pain, neck pain is chiropractic. We'll post some links to some articles, but really these are the guidelines. This is the best practices when it comes to neck pain, back pain, where it is not tumor, infection, etc. Where it's not, that isn't the cause of it, where it's mechanical in nature, at least by those terms. Neck pain, back pain, chiropractic is the first and most effective intervention, and also reports the best outcomes too among patients, both in clinical trials as well as in observational studies. One such article was in the Journal of the American Medical Association last year, talking about the role of spinal manipulative therapy, or what us chiropractors call adjustments, spinal adjustments, in the role of treating low back pain. And just like study after study after study shows, people that saw the chiropractor for low back pain, and it also accounts for neck pain and other conditions too, reported higher rates of improvement and satisfaction after a short course of care, 6 to 12 visits, as well as people a year later reporting better satisfaction, better outcomes. And then best outcomes are when they undergo a short course of care, but maintain, continue with wellness care, maintenance care, whatever you want to call it. It's always easier to prevent a problem than to fix a problem, whether it's with our cars, our bodies, our homes, whatever. So preventative maintenance, or maintaining a healthy state, again, of our bodies, homes, cars, whatever it is. So it's not just as a standalone has chiropractic been shown to be effective, and now the Journal of the American Medical Association is saying this should be the primary intervention, but certainly in contrasted with, chiropractic has the highest rates of positive outcomes and reporting of positive outcomes. Just a hair below that is physical therapy, and then about half of that is standard medical care. Hey, Gabrielle from Syracuse. Thanks for watching us here on Facebook Live. And I'll just say, for any of you who are out there watching us live, like Gabrielle, if you have questions, feel free to post them during the live event. And if Siobhan lets me know, I'll answer those questions live here on Facebook. And if I don't get a chance to it, then we'll do it afterwards. After the video is done, we'll comment below your comment. So, the question, both from, a patient asked me this the other day, and it's the question that is always in our heads too, which is, if the guidelines for a medical practitioner say you should be going to a chiropractor, why aren't people referred to chiropractors by their primaries? And I think probably the best answer to that is they just don't. Well, I think there's a 3-part answer. One is, in terms of being plugged into the most recent research, primary medical offices, family physicians, they have to look at everything. They're looking at all systems of the body, and this is one subset in their mind of the musculoskeletal system. So they may not be as up to date in terms of, the American College of Physicians, or Journal of the AMA, or the Spine Institute, organizations and journals and guidelines that are saying this should be the first intervention. So they may not be as up to date on that. Second is, really in medical school, you don't get much in the way of training of what chiropractors do. So most folks really don't know, it's not in their wheelhouse in terms of what chiropractors do. And then the third is often medical physicians don't know who to refer to because there's different chiropractors and different chiropractors practice different ways, which is why we try to coordinate care with the medical practitioners of our patients so we can co-manage care. In fact, right after we finish this video, I've got a call to make about one of our patients that we saw just Tuesday. So, you know, in terms of education and awareness, we're working on our part to try to work with medical practitioners to let them know what we do, why it's effective, who's a good candidate for care. And we encourage our patients to let their medical providers know that they're doing well here, that they're succeeding in their care here, so that, again, that might open the door to more education. So if next week, I'm not sure what our topic will be, but we're always welcoming topics or questions, so we can answer those for you here on Facebook Live. If we don't get a chance to do that, we can always comment on your comment, and you can always call our office to ask us, you know, if we can help. This, what are we, beginning of October. So we've had an opportunity for folks to come in through Facebook at a reduced cost that is going to end, I think, in a week or two. So there'll be a link here, but that is we're going to wrap up that special offer pretty soon. I think what's today, the 4th? The 4th. So it's going to wrap up in 8 days. So if you've been thinking about, gee, I think I might benefit from chiropractic, or that office seems like they might be able to help me out, these next 8 days are a great day to get that set up. Even if you schedule it for after next Friday, that offer is still good. It's just you need to let us know by next Friday. So the link is below. You just need to fill out that info, send it to us. We'll get back in touch with you and get you scheduled to see if we can help you out. And again, if you haven't liked us on Facebook, please go ahead and do that. If you haven't subscribed to our YouTube channel, please go ahead and do that so that you can be up to date and plugged in terms of what we're doing. And I'll look forward to seeing you next Thursday. And thanks for Gabrielle and anyone else who was on with our Facebook Live event today.